Geiger, and I'm the co-director of the Business Alliance for a Healthy California. We're pleased to bring you this webinar today. I'm going to do a brief outline of what we're going to be focusing on today. We're going to go through and just provide a brief introduction to who we are in the Business Alliance and provide an update on SB562, California's Healthy California Act, and then go into really making the case for single payer. Why do we need it? How does it work? Talk a bit about the national perspective. I don't know, maybe some of you, I just got off watching the Facebook live stream of Bernie Sanders and a bunch of other great folks, including one of our colleagues, announced the sponsoring of Medicare-for-all in Washington, D.C. So that was pretty great. And then we'll have about 20 to 30 minutes for Q&A at the end. So during the webinar, you can use the question function if you wanted to type in questions along the way, and then we'll answer them at the end. Okay, and so I'm Dan Geiger. I'm the guy on the bottom here on the screen, and Eric Leanson, the co-director, the founder and co-director of the Business Alliance. He's also on the line. He'll be available later to chime in on any questions, but I'm basically going to be doing the presentation. So who are we? We're the Business Alliance for Healthy California. We were founded earlier this year. We are a member of the Healthy California Coalition, the campaign committee, and also we're on the steering committee of that campaign and the policy committee. So we're very involved in the campaign, and we'll be working with the California nurses and a host of other organizations throughout the state as this campaign moves forward. We currently have about 140 businesses and business leaders who have endorsed our alliance and single payer for California. It's growing on a regular basis. We're fiscally sponsored by the American Sustainable Business Council, which also sponsors a group called Business Leaders Transforming Healthcare, which is a national organization of businesses working for single payer at a national scale. The person who has been a prime mover behind that effort, Richard Master, is the CEO of MCS Industries, a manufacturer and seller of picture frames in Eastern Pennsylvania, was just on the with the podium with Senator Sanders a little while ago, speaking about the business perspective and the business benefits. So we're a part of that network as well, and we have regular communication with folks around the country who are working on this. There's folks in Oregon, Massachusetts, New York, and a couple of other states are starting to look at it too. So our organization, basically, we have a vision. We want everybody to have affordable, high-quality healthcare. Our mission is to educate and organize the business community to support this vision. So we also, basically, we have a variety of programs. We do education like this webinar. We speak at a lot of events and such. We're organizing folks to speak up at critical times in the legislative process, and we're advocating as well. So probably a lot of you are involved in the campaign and have awareness about this. I'll kind of maybe go fairly quickly on this. As you know, SB562, the speaker put the bill on hold. It's really going to become a 2-year bill now, so the fight's going to resume next spring. And the speaker just announced the formation of a select committee who is charged with looking at all options of how to achieve universal health care. So there's, you know, the campaign is not crazy about that move in the sense of it could very well be a diversion from single payer, and it's not presenting 562 as the solution, but opening it up to a whole bunch of other options and so on. So we've issued a statement about that, and we are saying that we have a bill on the table now that we should focus on. Let's have hearings on that. But if the select committee process goes through, basically they're going to be having hearings on this. We've asked for those hearings to be held throughout different parts of the state so people can attend, and to make sure that the people testifying are representative. So we will be continuing to push to be involved in that process and have a debate on the merits. But that's the status now. This is, you know, This is going to be an ongoing issue. There's a lot of political strategies going on all over the place, but we in the campaign are pretty tenacious at staying on top of this, and we'll be engaging in this process as we move forward. So why single payer? And probably I might be speaking to the choir here, but we'll just kind of go through some of the highlights and then get into more of the business case. So reason number one is the right thing to do. I think we all agree with that. 56 million adults in the United States struggle with healthcare bills. It's a huge economic and social issue in this country and in California. 20 million lower income people can be pushed into poverty because of healthcare costs. And even this is with Obamacare. 28% of people put off getting needed professional care because of cost. Even if they have insurance, people do this. 60% of bankruptcy filings are medical bill related. Reason number two, the economy is being eaten alive by the healthcare system. I'm going to let somebody else who can speak to this well address this point.
It's 17% of GDP. People talk about corporate taxes, which are 1.5% of GDP. Healthcare costs is 17%. That is an enormous competitive disadvantage for this country. If you go back to 1970, there were half a dozen countries that were spending 7% of GDP on healthcare, and we were one of them. And we've run up to 17, and they've gone up to 10. So we've got a very major problem in this country. We can't keep doing this.
But Warren was right that our manufacturers have a huge competitive disadvantage caused by the health system, because the manufacturers providing the medical care for all the employees, and the European companies we compete with bobs that off on the government. It's a huge disadvantage. And of course, the cost goes up 3, 4, 5, 6% a year. So how can we fix it now? Well, it'd be easy to fix it if you had a benign despot. A benign despot would create a single payer system with people being able to opt out into private care that was a little faster or fancier. But I think having a basic level of care for everybody with no insurance aspect as a right, I think is a good idea.
So you
now, for a Republican, that's a very unusual way.
I was about to say, so you are saying a single payer system is really the answer?
Yes, and I think you people will live to see it.
So, not sure if you all saw that. I did get one message that you may not have been able to see that video, but it was Warren Buffett and Charlie Munger being interviewed about single payer. And I like what Charlie Munger said about it towards the end. You know, this is going to happen. It's inevitable. This is a message that we're hearing from so many people everywhere. It's going to be a long struggle. It's going to be a fight. There's going to be a lot of ups and downs and twists and turns, but the momentum is clearly building. And when you have people like Warren Buffett and Charlie Munger speaking out about it, that's a major, major breakthrough. So why do they say this? Well, and again, I think you understand a lot of the numbers. We pay, more than twice as much per capita as average developed country on healthcare. We pay twice as much on pharmaceutical costs per capita. As you know, we don't have a centralized system that can negotiate pharmaceutical prices, and that's even prohibited in Medicare. Yet we're ranked 37 in WHO rankings on health systems. And this is a system, this measurement looks at both kind of outcomes as well as efficiency and costs. So we're not doing very well, even though we spend twice as much as most other countries. Why? Because there's a tremendous amount of waste and complexity in our current system. Well, private insurance, we do have Medicare for older people and the VA, which is really like a UK type system, but the bulk of it is the private insurance sector. And we'll go into some of the reasons why that's very wasteful. So administration is huge. An average doctor's office spends about $84,000 on just administering insurance. I'm sure you've all experienced this. I've spent a lot of time, calling different when I've had to switch plans for various reasons, calling my doctor, do you take this plan? Do you take that plan? They have to, I don't know. You have to call your insurance company. They're managing, interfacing with all different kinds of companies. And 1 year they're in, next year they're out. It's just, it's an insane system. The waste in the system, here's a great illustration of the waste in the system. So when Medicare, which is single payer, spends $1, 97% of that, 97 cents of that dollar goes to medical care, which is what it's supposed to be all about. Only 3% for administration. With private insurers, it's 80 cents goes to providers. The private insurance industry has a term called medical loss. Medical loss means money that they spend on healthcare. Kind of strange terminology, but I think reflective of the general situation that you have in a for-profit system. So that 20 cents on a dollar goes to exorbitant administrative costs, marketing, and we can all see the kinds of money that's spent on advertising, marketing, billboards, all over the place. We're paying for that, and profits, and also executive compensation. A lot of these executives in these insurance companies are earning, millions and millions of dollars a year. Same thing with, so-called nonprofit hospitals. So we're all paying for that. We're paying for that for something that should be a basic human right. Number 5, this is good for business. Why? Well, there's tremendous cost savings for employers and employees. We'll look at some of the numbers in a moment for what that would mean for SB562, but reducing the overall costs of healthcare will reduce costs to employers. Most, something like 70% of people are insured through their employers. It's a big cost for them. On average, companies are spending, from 15 to 20% of their payroll on healthcare premiums. And we'll look at a little bit more in depth, like what that means for companies. They will allow them to reduce all their expenses on HR and administrative overhead. There are some companies have whole departments dedicated to this, and they won't have to spend money on that anymore. They can spend money on more productive things. Risk management is a big concern for business, right? So every year they're worrying and they're budgeting, like, well, what's going to happen with our healthcare premiums? How are we going to have to negotiate this with our employees? Is there a union involved? And it's a whole lot. It takes a whole lot of, management mind space to deal with this and manage it. And it's not something that, companies should be in the business of doing their business, not in the business of healthcare. Improved care will be available everywhere for everybody. So for employees whose families are fully covered, who aren't paying deductibles. They aren't paying a share of the premiums. They're going to be more likely to use healthcare, and many studies demonstrate that general health of the population is better under a single payer system, and people will be able to perform more effectively in the workplace. This will also stimulate entrepreneurial activity. So a lot of people might want to go into business for themselves, but they're reluctant to do so because they're afraid they'll lose their benefits at their employer. So it inhibits people from being able to move around, which to be more productive in an economy. And it also really, in this day and age, what we are experiencing in the economy in general is a tremendous amount of disruption in society, but also for businesses in society, of deindustrialization, globalization. You have technology changes, and you have the world of work really being disrupted, the Ubers, the gig economy, and so on. And so companies are having to deal with these changes, every year, and to be freed of the burden of providing healthcare for their employees, both financially and otherwise, will free them up, will free up their innovative spirit, and will generate more entrepreneurial activity. It will give the United States and California a competitive advantage to have this in California. So it'll be more attractive to companies to locate here. It'll reduce their expenses, and it'll give us the edge if we have it in California over other states. So specifically, here's some interesting kind of more particulars about these general points. I like this quote. This is from an article that was just out the other day in the Huffington Post by Dr. Paul Song. He's a well-known authority, and he's a member of our coalition. Prior to the bailout, General Motors spent more on healthcare than it did on steel. I mean, really take that in for a second. And escalating premiums consume companies' budgets. So it detracts from what they can spend on capital improvements, R&D, and higher wages. A lot of, labor negotiations are about healthcare benefits. So workers are sacrificing pay increases in order to maintain their health benefits. And even then, they're often being asked to pay some portion of the premiums. So it's like a lose-lose in that scenario. And if that's removed from the equation, they'll be able to spend money on more productive things, including their employees. They're shifting the cost to the employees. You can see here, premiums rose 83% from 2005 to 2015. And the amount the employees had to pay increased by 255% from 2006 to 2015, all of which leads to that money that could be used to help families and the economy instead is going into the pockets of the insurance company and the pharmaceutical executives. So this is not a system that's business friendly. This is a system that is extractive. In economic terms, there's a term in economics called rent seeking, which is really derived from real estate. We know a prominent real estate person. That's basically the idea. When you control a market, you can charge whatever you want. And like the landlord, for example, that's where the term originally came from, but it's generally used to refer to monopoly situations. And we pretty much have a monopoly situation both through, the political influence of the pharmaceutical and insurance companies. They spend upwards of $270 million a year in Washington, D.C. They're the single most powerful lobbying industry in the country, more so than the fossil fuel industry, more so than the defense industry. And they basically have rigged the system to extract exorbitant profits every step of the way in our healthcare system. And there's a great book, if you're interested in really getting into details on this, called An American Sickness. It's by Elizabeth Rosenthal. She was a reporter at the New York Times, and she's an MD herself, and she does a great kind of historical and very thorough analysis of how the industry takes money out of our pockets. So I highly recommend that book. Check it out if you have time. So what's happening in California? What's SB562? I'm going to go through some of the basics of what it is. I'm going to demystify this idea of, of what is single payer. So basically what it is it's one person has referred to it, it's not socialized medicine. It's actually a private Medicare medical system with socialized bookkeeping. So a public agency basically organizes and handles the financing. Delivery of care remains private. It's not tied to your job, your employer. Everybody's covered. And in the case of 562, that includes undocumented people. And patients would have more choice, freedom of choice of their doctor. No HMO plans, no PPOs, no restrictions. Basically, everybody's covered. There's one system. Here's how it works financially. The monies that are currently coming from the federal government, such as through the Affordable Care Act, Medi-Cal, Children and Infant Program, Medicare, any other public funding would go into a Healthy California Trust Fund. Also revenue from employers and individuals, and we'll look at a proposed financing plan for that portion of it, all go into the trust fund, and it pays for prescriptions, healthcare providers, and coordinated services, you know, institutions like Kaiser and others. So it's actually, you know, people say it's really complicated. It's actually not that complicated once you kind of understand the basics. So the basic advantages is that everybody has peace of mind. Everybody has guaranteed free healthcare. Excuse me. Everybody has more freedom. You know, conservatives like to talk about freedom. Well, this is freedom. You have the freedom to choose your provider. You don't have to worry about being constricted by a monopolistically controlled private profit-seeking industry that controls our lives. This is about freedom. We don't have to deal with in-network. We don't have to deal with out-of-network. You can go where you want to go. It puts money in your pocket because we're going to look at how much money is going to be saved system-wide. All medical expenses basically come out of our pockets one way or another, whether it's paid by the employer or through public funds, right? If you're buying a product from a company and that company has to build in the price of that product to cover their medical expenses, you're paying for it. So we're all paying for this. When we save system-wide, we all save. One of the big reasons why we're going to save money and it's going to be so much easier is it's clean and simple. No crazy quilt work of insurers and systems and institutions and conditions and crazy hospital bills that are charging you for all kinds of things you don't even know what they are. It just simplifies the whole thing, which makes sense, and it's going to make it a lot more efficient. It provides relief for businesses, as we already discussed. It reduces expenses, reduces administrative overhead, reduces risk, and as I mentioned earlier, it improves our competitive advantage. So everybody, of course, always says, oh my God, what's it going to cost? What's it going to cost? Well, it's actually, that's not the right question. The right question is, what's it going to save? So let's spend a little time on this slide. This illustrates the savings that will be realized under a scenario that was done by a study by the University of Massachusetts at Amherst, the pollen study. I'm sure many of you heard of that. So in the top portion, we have what is currently being spent on healthcare in California. So about 70% of the funds are public. Medicare and Medi-Cal is the largest portion of that. That's the blue bar. Excuse me. Other public sources, much smaller portion. And then you may or may not know that companies get tax subsidies for their payments for healthcare for the employees. So they get to expense that. And so that's basically, you know, it's a foregone tax, which comes out of our pockets. And the premiums that are otherwise that people pay is the yellow bar there. So that's being paid by employers and individuals. So we're currently spending almost $370 billion a year. We don't cover all Californians. What the Healthy California Act would do would eliminate all premiums and replace it with two taxes: a gross receipts tax for on companies that kicks in over $2 million of gross receipts. So gross receipts is basically all the money a company takes in within the state. It's not profit, it's the revenue that comes in. So that current thing is in 2.3%. There would also be a 2.3% sales tax that would have quite a few exemptions like housing and food and others that are currently exempted under the sales tax. So by the way, this scenario is a proposal coming out of the University of Massachusetts study. It is not currently written into the bill. It was part of what was about to be put into the bill, or at least discussed to be put into the bill when the speaker put it on hold. So we'll be going back to that and put this on the table, but it's not currently in the law. But it's a good illustration in any case. So under the new system, we'll look at the kind of savings that would be realized, but we will be able to insure all Californians, including the almost 3 million that are uninsured and the 12 million that are underinsured, and spend less money than we're paying now. We would spend about $330 billion to cover everybody, whereas if we were having to do it under the current system to cover everybody, we would be spending over $400 billion. So that's a saving of $70 billion. So when people say, oh, it's going to cost too much, the answer is no, it's going to save $70 billion. Don't you want to save money? So where do the savings come from? Well, there's the largest portion of the savings. It's about 18% projected savings system-wide. That's where you get that 73 billion number. A big chunk of that are structural savings on administration, and a significant portion is negotiating drug prices and payment prices. As I mentioned, the pharmaceutical industry has a stranglehold on the market. They, anybody who reads a paper or buys drugs know this, or they can charge exorbitant prices for drugs, whether they're new or sometimes, 15, 20-year-old generic drugs. Somebody buys the company and they jack up the price by, tens of percent, hundreds of percent. It's crazy. They will also do things like they'll have a drug and the patent will expire and they'll just tweak it a little bit and then reissue it as a a non-generic drug and jack up the price, even though there's no medical benefit. So we will be aggregating buying power through this Healthy California Trust to negotiate fair prices. So this is aggregating buying power to negotiate fair prices, as opposed to what's happening now, where you have a wide variety of institutions and people who are paying. Nobody has the power to negotiate the drugs. And insurance companies, for example, they negotiate to some extent, but they don't really care that much, because if they have to pay more, they just raise premiums. And so this is not a real market. This is not the way markets are supposed to operate. This is a rigged market. And by centralizing this buying power, we would be able to bring down prices significantly for drugs and providers. Other savings that can be realized are through a whole bunch of unnecessary services that are currently being delivered, and implementing better prevention systems and reducing fraud. When everybody's covered and people use more preventive health care, there's less need for the more expensive types of health care. That's one example. So bottom line is 18% savings, saves over $70 billion. It does not cost more. It's the wrong question. We have to change the framing of this issue to talk about savings and efficiency as opposed to costs and taxes. So how does this translate to a household or a business? So on average, like a middle income household could save about 9%. Actually, now I realize I think that's a typo on this slide. I believe it's 9% of their income. It's sort of basically for many people, this is like getting a very significant raise because they would pay no deductibles, no share premium, and nothing for prescriptions. And that's a huge savings for families in California. Businesses could save anywhere from 1% for very large companies to 22%. The graph that you see here illustrates the if companies are paying for insurance today, what percent of payroll they're paying. So for a very small business, if you have like less than 10 employees, you might be paying over 20% for your health care. If you're under the new plan, if your revenue is less than $2 million, you're going to pay zero. So that's like a huge savings for small business. And by the way, small businesses employ about half of Californians. There are, what's the number, 3 million or 6 million small businesses in California, and they employ half the people in the state. It's a very significant portion of our economy, and it's a very significant political power block, which is what we're focusing on in the Business Alliance to organize small businesses. So, and you can see the chart, the savings get smaller. The savings are the difference between the orange bar and the, whatever color you call that, the greenish bar. When you get to the very large employees, their savings are much smaller, but still, they're not paying more, they're paying less. So this is really good for everybody. It's good for households and it's good for business. So that's the last of the slide. I want to just mention a couple of resources and then we'll open it up for questions. You can always go to our website to get a lot of information. We'll have this webinar up on there. There's other webinars there. We're doing trainings for activists who would like to do canvassing and outreach to small businesses. We had a webinar last night about that to train activists throughout the state. We're going to do another one on Monday at 7 p.m. We'll be adding you to our mailing list, and you should be getting a notice about that webinar next week. So we're really focusing on getting more and more and more, and in particular at this point, small businesses to sign up in support of our mission and sign up in support of 562 throughout the state. Eric and I are both basically based in the Bay Area, but we want to get more people involved in Southern California and Central California and way up north in California. And through the coalition, we actually are in contact with a lot of folks who are wanting to get involved. So we have speakers are available, Eric and I are available, or we have other folks who can speak. We have a lot of resources. We are particularly interested in meeting with businesses who are willing to speak with legislators. So please get involved, and you can send us an email if you have ideas or if there's volunteer activities you'd like to participate in. If you know of businesses that would be interested, that would be really great. And do check out our webinar next Monday on training how to go and talk to small businesses. Canvassers are going and speaking with merchants in their local areas. So, for example, the Bernie Crats in San Francisco have been signing up a lot of local merchants in different neighborhoods. So there's all that. And I just want to mention there's a great film called Fix It that was produced by Richard Master. He's the person I mentioned earlier who spoke with Bernie Sanders today. And it looks at the single payer system and our basic healthcare crisis from the point of view of a business. And it's a great film. You can download it from the Fix It website. People are organizing events around showing the film. And so there's a 38-minute version available, and it's very, very effective, and people are using it for house parties or events and so on. So I really recommend you check that out. Watch it yourself, and or if you are interested in volunteering, you could use that as an organizing tool. So those are the basics that I want to cover today. I'd like to open it up for questions now. And if you'd like to ask a question, you can hit the question icon on your control panel and type it in. And we're starting to get some questions, so I'm going to start addressing them. So, will the slide deck be available online? Yes, it will. You should, I uploaded it to this webinar registration, so I don't know exactly how the interface works, but you should have it available as part of this webinar experience. You may be getting an email from GoToWebinar with a link to it, but we will put this up on our website as well, and we'll put a recording of the webinar as well if you know of other folks who would be interested in watching it. So just check the website in a couple of days under the resources tab. There's a webinar tab underneath that. So thank you for that question, Robert. Michael has an interesting question. How do we go about convincing big companies, Apple, Cisco, Facebook, etc.? That's an excellent question. So this is a much tougher sell. We have met with organizations that work with companies like this on healthcare, and what we understand, the general perspective for firms like that is they see their healthcare benefits as a competitive advantage. So they use that as a way to attract employees, attract and retain employees. They also, we're told, a lot of them have the view that they can do a better job than government in managing healthcare, that they care about the health of their employees, and they think they can manage it better than the government. It's also, companies, I think, are very risk averse to speak up about this issue because it's politically very sensitive. Richard Master, the person I mentioned earlier, he's met with CEOs of Fortune 300 type firms, some of them who have been very interested, like, hey, this is great, what can I do? They go and talk to their board of directors, and the board says, don't go there. Their boards have people who are maybe from Wall Street, insurance companies. Insurance companies are very powerful in the financial world, and they cannot get past anything on their board. So we intend to try to establish dialogue with firms like this, and we met with people like Chambers of Commerce and the Silicon Valley Leadership Group and so on. We're staying in touch with organizations that work with large corporations. We want to start a dialogue. We're hoping that as the momentum builds, they're going to start becoming more interested, and hopefully after today's launch of Medicare-for-all, they will have more interest. But getting them on board and being able to speak out publicly is going to be tough. And that's why we're prioritizing small businesses at this stage of the game, because it's, well, number one, a lot easier for them to make a decision, and it's a lot less risky for them, and they have a great benefit as well. So one day we'll get them, but it's going to take a while, I think. Would it be possible, here's another question from Robert, would it be possible to have a PowerPoint version of the slides that we could use in our presentations? Yes, I gave PDF because the PowerPoint is a really large file, and there's some images and things in there that make it really big. What I will do is, I think I should be able to upload the PowerPoint itself to the website. So check that, and if that doesn't happen, Robert, just email me directly, and I'll find a way to get it to you. Okay, thank you for that. Michael is pointing out you can click on business case September 13th to download the presentation. And as I mentioned, the presentation is in PDF form because of the large size of this particular PowerPoint file. So here's another comment from from Michael, I worked at Cisco for 10 years. Where would be an appropriate entry point for the discussion? This is a good question. HR, finance, senior management. So I would say finance or senior management. The reason is people in HR, who would be, usually top of mind of who you would talk to. Basically, they're invested in the current system, right? So like their jobs are to manage benefits and healthcare. So if that goes away, their departments are directly threatened. So they're generally not so friendly to this. What you really want to talk to is the bean counters. You want to talk to the finance people. I mean, in our dream world, we would be getting meetings with CFOs of some of these firms and making the financial case. Because other people like Richard Master has mentioned when he talks to HR, it goes nowhere. But you got to talk to like the top executive level, and finance would be a great place to start. So if you do know of anybody like in the finance department at a firm like Cisco or anything like that who would be open to a conversation, we would love to meet with them and just start the dialogue. The more we can get, even if it's just getting some influential individuals educated and on board about this, that's a start. Okay, are there any other questions? I'm not seeing any come in at this point. Eric, do you have any comments you'd like to make?
Can you hear me, Dan?
Yeah.
Yeah, no, just thank you. I think you did a really good job on the presentation. And I would only add that we're certainly looking for more supporters and allies throughout the state. So hopefully some of you on the call will find this interesting enough or are already involved in the SB562 fight to jump on board and help us mobilize business, because in the end, we think that this type of legislation will only be successful if there is some degree of business support. We're not expecting, obviously, the insurance companies and the hospitals necessarily to jump on board, but there will be a strong campaign against it, talking about the quote job killing issue. And we really need to have business, one, as a major populist sector, millions of people involved, but also as a way to blunt some of these unfounded attacks that will take place to try to get people opposed to this concept. So we all need to pitch in here, and thank you for participating and listening in on the seminar.
Yeah, and we got a couple more questions coming in too, a couple of comments. So very good ones. Michael, again, one more question. I see 3 problems with your focus on taxes. 1, everybody hates taxes. Definitely agree with that. In fact, Eric and I have talked about a proposal. Let's call it a premium instead of a tax, because basically you're substituting a health premium for another kind of a health premium. But I agree that word tax is not a great way to frame the issue. And Pollen's that sales tax is a regressive tax. So that's an interesting point too. There's been a lot of discussion about that. And the reason behind this is the way the benefits is structured is that, so in general, sales tax like that can be regressive. However, the low-income people will benefit disproportionately from the bill because the savings that they experience on healthcare exceeds what they would have to pay an additional sales tax. So in that sense, it's not regressive. And they talked about this a lot and doing it, and we're very committed to coming up with a progressive tax. And this is more effective than an income tax, for example.
Yeah, and it's Eric. Excuse me a second.
Yeah.
I believe that also incorporated here would be some sort of tax credit offset for really lower income people that do have some burden because of the increased sales tax.
Okay. Yeah. Okay. Third point. No matter what Pollen suggests, you or I or anyone else suggests, the legislature, once they start their horse trading and wheeling and dealing, will decide how to repurpose the 30% employee-employer contribution funds into Healthy California Fund anyway. Okay, I'm not sure if I understand what you're saying. You're suggesting that employers and employees will have to continue continue to pay that plus the additional quote unquote taxes or premiums?
If I may interject, Dan, I think what he's saying essentially is that, you know, the pollen study and the things that are being put forward are very rational. But once it gets into the legislative process, you know, it will sort of unravel a bit because people will have different interests and see ways of utilizing the funds. And that it's, you know, not a clear, you know, not a clear end to the fact that everything will work out the way it's being proposed in legislation, which I understand, but that's basically part of the legislative process, and there are different interests at stake here.
Right. Yeah, I mean, that's a fair point. I mean, politics is tricky, right?
But to the extent that we can organize as a business community and put forward what we think makes most sense, that can be a factor in the debate.
Yeah. Okay, we have one more question from James. Do you have hard copies of flyers, et cetera, for people who want it? So the flyers and things are available on our website, and there's a tab under resources for small business organizing, and there's a PDF that you can download that has copies of the flyers that you could print out. If you need something that's already printed, if you could send us an email, we have some that we could mail to you.
And I should add that we have them in several languages, in Spanish, Chinese, and Korean.
Yeah, right. Okay, and then Michael's, what do you think of Sanders' plan? I didn't hear the whole presentation, and I haven't seen the plan. I was getting ready for this while the Facebook thing was streaming. I don't know, Eric, do you have any? What I heard this morning sounded very similar to 562. Like I think I heard no deductibles, no premiums. You know, it's a phased-in approach to over 4 years. I think they're first going to take Medicare down to age 55, first year, then down to, I think, 45, then start covering children. They're going to expand coverage, including, I think it was dental, chiropractic, vision, some other things. And I think it was by year 4, basically everybody's covered under Medicare with expanded benefits. There also is a provision for some private insurance that's kind of analogous to the Canadian system, I believe. I don't know, Eric, if you watched the whole thing or if you saw that, but I'm sure there will be a lot coming out in the press today. It may be good to watch the Healthy California website. They have seen the legislation prior to the announcement, so they probably will have an analysis up on their website, I would presume, in the next day or two.
I didn't see the much of the webcast, but I read about it in several blogs that came out. And, you know, we'll get many more details, as you say, in the coming days. But what I would point out is it appears that the proposal is extremely compatible with what SB562 is talking about. Yeah. You know, kind of across the line, across the board, in terms of general conceptual principles, there seems to be a great deal of similarity, which is not surprising when you consider the fact that the leaders of the Healthy California Coalition and the folks who actually are the sponsors of the bill, the California Nurses Association, is very closely allied and a big influence on Bernie Sanders' thinking in terms of healthcare.
Right. Yeah, one point to add on this is, you know, there's people are talking about, well, you have Bernie's bill nationally, Medicare-for-all, and then you have California, and are they conflicting, and how do you look at those, and how do you prioritize? And I think, you know, there are two ways that this could happen in this country, you know, state by state, which is basically the way it happened in Canada. You know, there was I think it was Saskatchewan did it first, and then a few other provinces, and then over a period of time, the whole country went to it, and or doing the whole country at once. I mean, I think looking at the situation, the politics of it, you know, it's going to be pretty tough to get anything through Congress. I mean, nothing's getting through Congress with Republican control, and certainly with Trump in the White House, maybe eventually. that could happen. But in the meantime, if we can get this established in California and demonstrate to the rest of the country that it works, and other states start picking up on it, the momentum will build for a national system. In my opinion, that's the much more likely scenario.
I think as we watch this debate unfold, a key element to look at in proposals or in amendments that are made is always what is going to be the role, if any, of private insurance, because that's where you really see kind of where the rubber hits the road. And SB562 and I think the Sanders bill are both very clear that there is a very limited, if any, role for private insurance, that healthcare should not be a private profit center.
And here's one more comment. James is pointing out that Medicare recipients will also get a 2% rebate to offset sales tax. So that's another point addressing the regressivity of the sales tax. Okay, any other questions? That's the last question that's come in so far. So here we go, one more. How will Medicare folks be impacted? So basically, anybody that's on Medicare now will become insured under the Healthy California Act. And it'll actually be better for them because the coverage will be more comprehensive. So funds from Medicare that come to people in California will go into the trust fund, and everybody, regardless of age, in California is covered. So they would transition to the California system and have superior coverage. Yeah, so comment today, Michael was saying today, I'm on Medicare and pay $139 a month plus $99 for supplementary. Will I pay more in sales taxes or less? So yeah, you wouldn't be paying the $139 a month and the $99 for supplemental, so that's going to save you, almost $250 a month. You would pay more in sales taxes, 2.3% with several exemptions. So, I don't know, I guess a lot of that depends on what your spending level is and income level, but it'd be interesting, if you wanted to do a little math on that and send us that analysis, that would be quite interesting. But at the macro level, the pollen study shows that the large swath of lower and middle income people are going to save significantly under this scenario, whereas high income people are going to be paying a bit more. And that's the very, very high income people would pay a little bit more.
And keep in mind that the items that are currently exempted from sales tax will remain exempted. So, for example, that will not be applied to food and other things for which many people spend a good deal of their income.
Right. What are the details of the sales tax? On our website, you can download the entire pollen study I think it's under the resources tab, the economic analysis. And if you want to read the whole thing, it's there. It's a 80 some page PDF, but you could probably pretty easily find detailed answers to some of your questions on that. And again, this is an analysis. It's not currently in the bill. The way the financing happens, other people have talked about an income tax or a payroll tax. So, we'll see how it works out, but this is, the kind of most effective progressive scenario that the authors have come up with at this point, or the sponsors, I should say. Okay, we're at 12:55. No more questions, but thank you, Michael, for your thanks. I appreciate it. I love all your questions and comments. Unless anybody else has any final comments or questions, we're going to close this up. You should be getting a survey at the end of this. It's a very simple thing, just how we want to understand how useful this is, and any other comments you might have, things you'd like to see, and if you'd be interested in getting involved with the Alliance to kind of carry the message to you and your colleagues and friends and your community. So thank you all very much. We really appreciate you joining us today, and we'll be doing these webinars again. We'll be putting this up on our website. It'll get up there in the next day or two, so share it widely with any people that might be interested in, and we look forward to seeing you on the campaign trail. We're gonna win this. It's gonna take a while, but we're gonna win this. The momentum is on our side. This is a time of great opportunity. You know, in some ways, I think Trump has given us a gift. You know, he has clarified so many issues for people in this country, and he has inspired and mobilized so many people in this country to move in the direction of a more just, fair society that I think we all, by virtue of you being on this webinar, share those values. So despite all the terrible headlines from the craziness in DC, the momentum is on our side, and we have a really good chance. We have an historic opportunity to make some big change in this country for the better. So let's get on it. Thank you very much, and take care. Have a good day. Signing off.